Obulamu, 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 obulamu,
nabuulirako nga TB simanyi bwaluma kyekituufu.
I heard about TB. But the truth is, I didn't know how painful it is. I heard that if you smoked cigarettes, smoked pipe, or indulged in alcohol, generally things to do with smoke, that is the cause of TB. It started like a fever. I was sweating at night, and then started to wonder what condition I was experiencing. I tried varieties of medicines, especially the herbal type. I would boil shrubs, but the cough, it just wouldn't go away. I still had a persistent itchy throat.
People end up going out to look for treatment, herbs, because it's a cough. And then they don't know that they're actually having TB.
We have a very huge element of self-medication. In many cases, the people treat conditions that they don't know, that they don't have. The rich, the poor, they go and buy medicines over the window, in the pharmacies, in the drug shops. And to me, this is the biggest problem. And it's so prevalent. It's almost in uncontrollable levels.
I was so sick that I weighed only 19 kilograms. I looked so tiny that I would be blown away by the wind. I then decided to go to the hospital where my chest was examined and my sputum taken. On returning for my results, the doctor told me, "Edward, you will be on medication for 2 years. You are going to be admitted." I was shocked. I walked out of the hospital and said to myself, there is no way I'm taking this medication. If I die, so be it.
Usually when someone is first diagnosed with the TB, they do that self-denial. They kind of don't accept it immediately. They do have TB. Where did I get it? How did I get it? Why me? All those kinds of things.
On my way out, I said to myself, even if I go home, I'll be returned to Mulago Hospital. I pleaded with the doctors not to admit me, but they said, for your life's sake, let's admit you for 3 days, during which you will receive injections. Thereafter, show us a nearby clinic to your home and give us a phone number of the clinic attendant. I was supposed to return and pick items from the hospital, but the moment I got home, I did ask myself, why was I going back to the hospital? I am not going back. I talked to my siblings about it and being admitted for 3 days plus 180 injections. Truth is, I was scared. Imagine taking tablets for 2 years. It was too much.
Of course, when somebody stays with TB for a long time and it's not treated, it becomes now chronic and results into the multi-drug resistant TB. This is why it's important for people to actually get tested early and get treated early. And of course, the multi-drug resistant TB even puts you longer on drugs as compared to if TB is detected at an early stage. You may take drugs for about 6 months or 1 year, and that is it. But if it graduates, then you need 2 years or more to have this TB treated.
The truth is, the last time I had an injection, it was for immunization. This time round, the injection would be for TB. Naturally, I fear injections. I had to endure injections to save my life. Secondly, I have only one little daughter, whom I have to live for. I started medical treatment and would go to hospital every 1 month for check on the sputum. I started feeling better, my strength was gradually coming back, and I could fairly stand on my feet. The doctors told me, your results are changing for the best. But I had to adhere to treatment without fail. If I didn't, I would have to be brought to hospital anyway. I have a friend who ran away, but he was brought back to hospital to complete his treatment. He called me recently to thank me for encouraging him to complete his treatment.
And the counseling we provide in drug-resistant TB is because we know you're going to be on treatment for 24 months. And it's not going to be easy for you to take this treatment alone. You must take it with the support of other people around you, family members, and so on and so on. And if you don't actually adhere to a multi-drug-resistant TB, then you are likely to get extra drug-resistant TB. This is the extreme part of drug-resistant TB that is actually more dangerous. We have had almost, I think, 2 or 3 extreme drug-resistant TB in this country. They have all passed on.
kubanga abantu abamu baddukanga mu ddwaliro bo baafa.
Some of the patients who ran away from hospital all died. Even those I found there who absconded all died. Yet those who are dared and recovered are many.
But we'll be able to avoid to get to the extreme drug-resistant TB. Manage well your multi-drug-resistant TB.
Abamu ne bannange be nabeera nabo n'abalala be twekubiriza tumire eddagala.
Those who were my fellow patients at the time, together we would encourage each other to adhere to treatment. We all recovered and are alive today. It has been 2 years since my recovery, and I've not had any problems. If one says there is no money for treatment, my advice is go to the government hospital where I was treated from at no cost. The only cost would be that of transport. Even then, the hospital facilitated my transport, so treatment is free of charge. Also, the cost comes in for the medical worker near your home to administer the TB injection, which is manageable considering that life is so precious. If it weren't for my daughter, I would never have gone for treatment. I would have run away and disappeared. That is the truth. It is because of my little girl that I endured treatment.
All of us are at risk of TB. An HIV positive person is the most vulnerable because of the immune depletion status of the HIV disease. A child below 5 years is the most vulnerable because of the undeveloped immunity. An elderly person is the most vulnerable because of the depleted immunity with the age. Prisoners, if you are in a prison, you are most vulnerable because of the congestion, the conditions you live in, the likelihood to suffer malnutrition and other factors. Malnourished people are vulnerable. Health workers are vulnerable because they deal with these people every day. They are vulnerable.
In every district, you'll find at least a health facility where somebody can go and get tested for TB. Secondly, what government has done is to ensure that the drugs for TB are actually available. And they're available in all the health facilities. If you move in all the districts, at least there is a point where you can go and get your drugs. And most importantly, it is free of charge. So there is no charge for it. And of course, we have also invested in the gene expert machines, which is a more advanced equipment for detecting TB cases. We've also got support from the USAID government, and more equipment have been procured. Our plan is to ensure that at least in every district, we have the gene expert machine.
We are really very grateful to our partners for the great work they have done. Thank you to our dedicated health workers daily for screening. A number of them have actually even got infected with the TB, but have managed to live and survive. We're really very grateful to these frontline soldiers for the great work that they are doing, and we continue to wish them luck and pray for them that they may be able to be successful in what they are doing, especially in helping our TB people to get better. We are really very grateful to USAID for the funding that they are giving to Ugandans in terms of managing TB. We are grateful also to the government of Uganda through the Ministry of Health for taking the stewardship in making sure that they have come out boldly to say that, TB is a problem and we need to manage it together as stakeholders.
Of course, a lot needs to be done in the area of prioritizing tuberculosis as a disease in terms of talking about it. There are many other less dangerous conditions that receive media coverage, free airtime on TVs, on radio, free space in the newspapers. Diseases like tuberculosis, which continue to kill more than 2 million people globally, which continue to kill more than 6,000 people in Uganda annually. Those are 2 parishes, village parishes erased, which affect more than 100,000 people. That's more than a constituency. A constituency every year. They don't receive this attention. Money needs to be spent in the fight against tuberculosis, even by the implementing partners. Some of them don't spend real money on the fight against TB.